Welcome back. Joining us right now, Mrs. Elsie Ilori, Director Surveillance and Epidemiology, Nigeria Center for Disease Control. She joins us via Zoom. Thank you for joining us on the program.
Thank you for having me. It's a real pleasure to be here. Thank you.
All right. Tell us, for you, how has it been managing the coronavirus for a year since lockdown?
Oh, well, the COVID pandemic actually has really, triggered a lot of response. It's been the response has been so dynamic globally, and for Nigeria, we have been able to do a lot in terms of coordination, and this coordination has been led by the PTF, the Presidential Task Force. It's been very, very, very dynamic for us. And it has also helped in building the infrastructure, some infrastructure in the country. We've used this as an opportunity to build the infrastructure in the country. We look at infrastructures just like the laboratories. We've had from 3 laboratories that were able to test for COVID. We now have up to 70 laboratories that can test for COVID. In fact, we also have 2 sequencing labs, 2 labs that can do sequencing. That's the Redeemers University and that of the National Reference Laboratory at the NCDC. So we've been able to build structure from the pandemic. We're not saying that we like the pandemic, but it has helped in the health security activity, and making sure that we're able to do a lot of things, a lot more things that we would have done if we had not had the pandemic.
So, Dr. Ilori, looking at it, I mean, what would you say was the major challenge, and what do you see us doing as we move into the future?
Now, one of the major challenges for us was the non-compliance with the non-pharmaceutical interventions. And that the PTF had done a lot in that area too, using the structure of the Ministry of Information, the risk communication structure, to get across to all those relevant people that will need to get the messages across to the people. They have been able to get across to the traditional rulers, the religious rulers. And so, yes, we have this challenge, but we're also trying to overcome this challenge in terms of having proper coordination and collaboration with so many stakeholders that have gone out there to talk to the people. You're one of the stakeholders that have done that, and this program, I'm sure, is also one of the programs that you have been doing, updating Nigerians on COVID situation in the country and what the people are expected to do. And so we have done a lot in that area, and making sure that people take responsibility in terms of being able to take care of themselves and use take the necessary non-pharmaceutical interventions that have been put in place, wearing of masks, making sure you wash your hands regularly, use this hand sanitizer, avoiding crowded area. And of course, if you're in a crowded area where you cannot avoid, you use your face mask and wear it properly, covering your nose and mouth as it should be. Thank you.
We appreciate your time. Thank you so much, Dr. Elsie Ilori, Director Surveillance Epidemiology with the NCDC. Thank you for talking to us.
Thank you for having me. It's a real pleasure.
Drug maker Pfizer is saying its research has shown the BioNTech COVID-19 vaccine is 100% effective in children aged 12 to 15 years and gives a strong immune response. Let's take a look at more on this in the Global Updates.
Paving the way for U.S. emergency use authorization, Pfizer and BioNTech say their COVID-19 vaccine is safe and effective and produced robust antibody responses in 12 to 15-year-olds. Pfizer hopes that vaccinations of the group can begin before the next school year. The vaccine is already authorized for use in people starting at age 16. The World Health Organization says Chinese vaccine makers Sinopharm and Sinovac have presented data on their COVID-19 vaccines, indicating levels of efficacy that would be compatible with those required by the WHO.
We have Dr. Mercy Edionwe, internal medicine hospitalist, Texas Hospital in the U.S. She joins us for more on the global situation. Thank you for joining us on the program.
Thank you. Happy to be here.
I want to briefly start your thoughts, since the pandemic started, and what you think about how Nigeria has handled things so far as we mark the anniversary of the lockdown.
Well, thank you so much, like I said, for being here. As you have mentioned, the lockdown was started by the president on March 30th. And when there was a lockdown, that had helped with the decreased amount of cases that Nigeria had seen. There actually has been a case study that has looked into how Nigeria's impact of the lockdown, what it did when it came to the cases. And so towards the end of that lockdown, Nigeria didn't saw less than 2,000 cases that were rampant in the country of COVID. As the easing of the lockdown, though, there was a surge, if you will, of the number of cases, and it went as high as 12,000 in July. So a lot of factors came into play with that, because of the economic constraints when it came to being in lockdown. A lot of people could not afford to stay locked down forever. There were some people who weren't totally adherent to the guidelines of social distancing, wearing a mask. So that all came to play. But I do say that the president instituting the lockdown early when he did help in the number of cases that could have been.
All right, finally, Dr. Edionwe, in comparison to the U.S., lockdown was early, but still, would you have wished it was much, much earlier, seeing as the U.S. is witnessing a lot more of cases and there is the threat of a fourth wave? Briefly, please.
Yes. I thank you. I would have wished here in the U.S. that there was a lockdown, a nationwide lockdown earlier. The former president, he did kind of give the decision of lockdowns to different states. So each state had their own version of what the lockdown was and whether or not they would go into lockdown. And so when we were seeing those high cases in New York, at that point, I wish there was just a universal lockdown. I feel like it would have prevented a lot of our cases that we experienced.
All right, we appreciate your time. Thank you so much, Dr. Mercy Edionwe, internal medicine hospitalist, Texas Hospital in the United States. Thank you for joining us on the program.
Thank you.